March is National Brain Injury Awareness Month, a time when advocates remind the public that brain injuries do not discriminate, as they can happen anytime, anywhere, to anyone. Here to talk with us more about it today, how you can prevent them, is Dr. Rhonda Ross, a neuropsychologist with the Lovelace Rehabilitation Service. Good morning, Dr. Ross. Thank you for coming in.
Thank you.
A lot of people call these TBI. It's basically traumatic brain injury, but they follow. It's a wide range of stuff that can happen to people and be considered this, right?
That is correct. A traumatic brain injury is defined as a hit on the head that has sufficient magnitude and force that will disrupt brain function. Brain injuries can range in severity from a mild traumatic brain injury, we often know that as concussion, all the way to a severe traumatic brain injury that can result in life-threatening injuries or even death.
Okay, I think you see, you hear a lot sometimes with the minor ones. We talk about kids and concussions in sports. Some of the severe ones, you hear a lot with our troops coming back after they, say, have an accident with an IED or something like that, or a really bad car crash for folks in the States, right? That
is correct. Oftentimes when we look at traumatic brain injury, we're not really sure what the symptoms or signs or symptoms to look for. I think a good illustration of individuals to be more aware of what brain injury looks like is being aware of those symptoms. For example, something that we're familiar with. We all watch a boxing match on TV.
Sure.
In the first round, the boxers are coming out. They are able to think clearly, behave adequately. Their physical movements are coordinated, skilled, fast. As they progress through each of those boxing matches, you will see a decline in attention and focus. Their targets of hitting the other opponent, they're not on target. And those are examples of what the signs and symptoms of traumatic brain injury are.
I think this morning it's important for parents of young kids who play sports to be especially aware of this. There's so much talk in the news these days about concussions and the risk and the long-term consequence of them. What can parents do if their kids go off, even if they don't think it's a contact sport, so to speak? Like if they go play soccer, it's still possible for kids to get these mild concussions, and something parents need to look out for. What should they look for in their kids if they are playing these kinds of sports?
Well, we know that one of the leading causes of brain injury in the young, especially from birth to age 4, are falls. The sport-related injuries are actually becoming more aware in the media.
Sure.
Things that you want to do to be able to prevent concussions in that particular age group. Make sure that you have protective gear, such as wearing helmets. New Mexico, the Department of Health, is now offering free helmets. And it's important to be able to recognize how a helmet fits properly. Some of those sports, contact sports, soccer, baseball, football, but just as important, riding bicycles, riding scooters, skateboarding, skiing, snowboarding, all of those things require safety gear to prevent a symptom, or a brain injury. There are free apps available that are based on Android platform, Apple platforms that will actually educate parents and coaches on the signs and symptoms of concussion, but they also give you a guideline of how to track and monitor those symptoms to determine, is this individual ready to return to play? Do they need immediate medical attention? So there's lots of resources out there for free.
Okay, if you want to find those, it's very simple. Go to our website, KASA.com, click on the KASA blog, Dr. Rhonda Ross, and there's so much more I could talk about today. But again, the big thing I think you hit on is parents, make your kids wear a helmet when they ride a bike. And never ride a bike without a helmet, even if I'm just going down the block. It's not worth it.
That's right.
Okay, doctor, thank you so much.